Great. Thanks a lot, Sadia. And thanks everybody for taking time out of your busy schedule to join us this evening. I'm thrilled to be part of this panel today, and you should be very excited to have three heavyweights from the home care industry participating today. I'm just kind of along for the ride. All right. So why don't we get started? Next screen. So the National Aging in Place Council um, is for the Chicagoland chapter is who we represent. Our mission is to educate and empower families and communities in the Chicagoland area to live safely, independently, and comfortably in the home of their choice for as long as they choose. We are a group of licensed professionals, business owners, and advocates who are committed to providing public outreach, educational meetings, and programs to inform and educate older adults, their families, and elder care professionals about senior focused businesses and resources. Essentially, we are individual professions that touch the older adult somewhere along the way. We collaborate and work together and find that we can help a lot more older adults live more comfortable lives by getting multidimensional services from a number of different providers. We learned from experience and networking that we have a large network of resources to offer to the older adults and individuals who want to age in place. There are 14 chapters in the US and many more in the formation stages. There are already over 25 members of the Greater Chicagoland chapter. Next. So happy birthday, boomers. Every day for the next 20 years, 10,000 baby boomers will reach the age of 65. Quite an incredible number, huh? We are aging rapidly. Currently, there are 56 million Americans over the age of 65. By 2050, less than 30 years from now, that number will climb to 84 million people. So next. So we are an aging nation. There's no doubt about that. And as we are living longer, you know, and I'm sorry, we are living longer. Currently, there are 7 million Americans over the age of 85. By the year 2050, that same year, that number will have more than doubled to over 19 million people. Again, pretty amazing statistics. So next slide, please. So what does aging in place mean? Well, I'm going to try to read the slide, but let me see if I can move. There you go. I can do that. I had other panelists in the way. So aging in place is a term used to describe a person living in a home of their choice for as long as they're able to do as they age. It encompasses the ability to access any services, assistive tools, or other support that might be needed in the person's chosen residence over time as needs change. Next slide, please. So there are several components to a master plan for aging. You know, there's, and it's really important that you have a master plan for this. Aging needs require a review of each of these components. One component is housing, and it changes to how you live safely. Health and medical. What is your status now? And what may your needs be after a serious illness or event, such as a stroke? And really, this is the area of focus for today's presentation. On the financial and legal side of things, you know, what sort of help and assistance can you get from elder lawyers, accountants, and financial planners, and what kind of services can they provide to you to help with this master plan? Transportation is important, right? What if you can no longer drive? You know, what services are available to you? Pace bus, community transport, volunteer services. Do you know how to use Uber or the old fashioned yellow taxi? And finally, community and social access. What kind of technology exists to allow you to have interaction with the outer world if you've become outbound or homebound rather? And what social groups and activities are available to you when you are able to get out? What are your hobbies? What are your and your interests. Next slide, please. So how do you successfully age in place? You need to have a plan in order to do so. Planning to age includes housing, your residence or your community, financial planning so you have the adequate resources to pay for your older years. The reality is there's a shortage of care providers, and so you need to choose a reputable licensed agency when going through the process of hiring a caregiver on your own. Doing it on your own can be risky. It can be stressful. On average, the closest family members live 288 miles away. I'm not sure who came up with that statistic, but and the family unit is shrinking to an average of only 3 family members. So it's not like the old days when you had multiple kids and you had many possible family members to assist you. That has shrunk. And the reality is COVID has changed everything. So many people now are choosing to stay home longer than they did before. Just about anything can be done in the home, from hearing to dental to telehealth, health to care for your personal care needs. And most older adults prefer to remain at home for as long as possible. So we're going to talk a little bit about your trusted professional network. And this is a list of individuals that over time, hopefully you've been able to add to your people of contacts that you have confidence in to be able to ask questions and to have them give you valuable information. So a certified aging in place specialist, someone who can assist you with home redesign and modification so that perhaps you can age in your current residence for a few more years. Elder law attorneys can provide many valuable ideas for you, including and up to estate planning documents, planning for Medicaid if that's down the road. A financial planner, he can help you assess what your current assets look like and how they can be maximized for your future needs. In the home health care arena, both medical and non-medical, which is going to be a big focus of today's presentation, we concentrate on what kind of aid is out there for you in your home. And finally, occupational and physical therapists can provide great resources for you to help you become more physically fit and allow you to live in your home even longer. So some talking points. We've already discussed a little bit about how we are aging and living longer. So now let's look a little bit at the continuum of care. And we're going to explore the home care industry and the 3 models of agencies and caregivers. Today, as we go through, we're going to provide an in-depth discussion in each area and the risks and liabilities of each, from management to payroll taxes to training, liability, supervision, agency costs and fees, and what are some good questions that should be asked as you're exploring these options. And next, so the question, who will take care of me? 70% of the 70% of us will be unable to care for ourselves at some point. And an even higher percentage, 9 out of 10 of us, will want to stay at home, which I think we all greatly understand. So at this point, I'd like to turn things over to John Cushing. So John?
Thank you, Rick. I appreciate that. Hopefully everybody can hear me, and I've unmuted myself. So who is going to provide the care? As the slide says, traditional programs, much like Rick mentioned, are not really enough. The family unit is people are, in this day and age, spread out all over the country, smaller families, things like that. So it's not like they've got the bandwidth to take care of their parents. Many times we've got the sandwich generation involved where they're raising children of their own, and yet now they have to take care of their elderly loved ones. Private pay home care fills the gap. You can have either a private caregiver or go through an agency where a caregiver comes into the home and cares for the client does light housekeeping, meal prep, planning, running the grocery store, things like that. So that's one non-medical basic way to provide care. Obviously, there's hospital stays, very expensive, regardless of insurance. And then from a hospital, you go to rehabs, and then perhaps to a skilled nursing facility. And then once you get discharged from skilled nursing, you've got home health, which is a separate company that comes in with skilled nurses. Typically, they do not only a nurse comes by, but they also do various therapies, physical, occupational, speech. There's palliative care, another step along the continuum of care. There's hospice, obviously, as a transition to an end of life. Memory care. There's plenty of memory care facilities popping up like Walgreens. And then obviously family caregivers. So next slide, please. So there's the emergence of the home. I can't really see here because Rick's in the way. There's been an emergence of the home care service industry. So it's relatively young, as the slide says, less than 50.
You can slide the panels out of the way if you want to read.
Thank you. Well, he's old, but he's pretty knowledgeable. What isn't old is the home care services industry. It's less than 50 years young. And initially, it was the Wild West. It went from, everybody could just slap a shingle outside in their home care agency. Well, now it's highly regulated and licensed in Illinois. There's approximately 780 licensed agencies in Illinois. To the north, Wisconsin, they are still unlicensed. And to my knowledge, and please someone correct me if I'm wrong, but recently I knew for a fact that you didn't even have to have your home care workers get a background check in Wisconsin. So that's a little frightening. So now, like I said, there's 780 licensed agencies in Illinois, but there is no shortage of clients. So next, please. I'll take you through what home health versus home care, private duty or non-medical. So as I mentioned earlier, a couple slides ago, home health is driven by the hospitals or the skilled nursing facilities. The doctor will write an order for a patient upon discharge to get home health, and through Medicare, that's usually covered for a number of visits. It's 6 to 9 weeks, I believe, something along that line, but it's based on visits. And again, it's a nurse, and then whatever therapy comes along the patient would need. And the nurse just makes a few visits a week, and it's the therapist as well. So it's not like they're there caring for the client on for hours at a time. Home care services are, private duty, meaning most home care agencies, non-medical, do not take Medicare or any insurance other than long-term care insurance. And long-term care insurance, was extremely popular, probably writing policies back in the 80s and 90s, and then it got the actuaries got in some trouble because they realized all these people are living a lot longer and it's going to cost them a lot more money than they anticipated. So they stopped writing. A lot of companies stopped writing the policies and then just raised their rates significantly. Another way to pay for home care services is through veterans benefits. My father himself was a veteran, served during the Korean War and was eligible for aid and attendance benefits. Took a while to get to that point where we were able to actually get the benefits, but it worked out great. It was allowed us to pay for his benefits or his home care through those benefits. So great program. It's only eligible to active duty wartime veterans. So you have to be in the military, branch of the military during a war or conflict. I don't know how they describe that. And then there's some state programs as well as county. There's some county programs where you can get some funding to care for your loved one. Next slide, please. All right, so duties of home care worker, I know this quite well. They support the activities of daily living, ADLs. They'll do anything like I mentioned before, toileting, shower, bathing, dressing, meal prep, planning, help assist with ambulation, meaning if a client has some mobility issues, uses a walker or wheelchair, they'll assist with that. Transfer from the wheelchair into a bed. Obviously the first and foremost priority of a caregiver should be keeping the client safe. Companionship, especially during, these last 11 months or so. COVID has really taken a toll on the elderly as far as the companionship. If facilities are not a lot of visitors, and obviously out of respect for their health, people aren't visiting their loved ones because they don't want to get them ill. But as a result of that, they're lonely, and that is, I'm not going to say it's as devastating as the disease itself, but it really has presented a great challenge. So, and I'm sure, much like our own home care agency, all the other ones out there, their caregivers are taking all the being proactive and following all the protocols of the CDC as far as hand washing and masks and gloves and all the PPE. So obviously that's extremely important in keeping your loved ones safe. Also medication reminders, another one. They can remind the client to take their medicine. So, next slide, please. And the benefits of home care, obviously, especially I should say, with respect to anyone with any sort of dementia, staying in routine is important. I saw that with my own father, keeping in his routine in his own home where he's familiar really grounded him significantly. Anytime he had to go into the hospital or into a skilled nursing facility, it really kind of threw off his, really aggravated his dementia. So they can enjoy independent living longer, being in their own home. Certainly reduces falls and common injuries because they're familiar with the surroundings. And as a result, it keeps them healthy. And if you're in the home, more than likely, outside of COVID, obviously you have your neighbors around, loved ones, friends, people that you've socialized with over the years, hopefully are still around, and they keep you engaged and connected. So those are some of the benefits of home care. Next slide, please. So there's, a number of ways to establish how you want to go about engaging a caregiver. You can go with a full service agency. So meaning, home care agencies such as Touching Hearts at Home or Wisdom Elder Care, whatever that Gina's involved with or is the owner of, where they do all the work as far as hiring the caregiver, doing all the background checks, doing all the proper training, following all the guidelines from the Illinois Department of Public Health, and matching them with your client's needs. Another means of going about this is through a placement agency, where strictly they're not hiring, the caregivers don't work for them, but they will find a caregiver for you, much like a headhunter finds a applicant for a position. Or private hire. There's plenty. You can go to care.com or any number of these websites that, or even on Facebook pages where you can find private caregivers. And there are advantages to private caregivers in the sense that it's generally less expensive than going through an agency. You can find, very experienced caregivers that only work privately, but, what happens when they're sick, because people are human beings and they get sick and they can't be there, or a car breaks down or this and that. And with an agency, you get, the luxury or the benefit of being able to get somebody to fill in right away. And it's important, with respect to placement agencies, I'm sure they use, licensed full service agencies to get a lot of their caregivers. As Rick mentioned earlier today, or early in the presentation, caregivers are in huge demand right now. COVID has really accelerated the demand for in-home private care. And I know every agency we're familiar with and we talk to is fighting the fight to not only recruit, but retain high quality caregivers. Next slide, please. So management and oversight. As I mentioned, the full service agency will do all the screening and supervision and training. We'll also handle the long-term care insurance claims and provide all the paperwork to the long-term care insurance. Again, over all the COVID protocols and provide PPE equipment. Placement agencies, depending on the agency, they do limited screening as far as background, and the family becomes the employer. So there's, the onus is on the family as far as workers' comp, providing workers' comp and filing taxes. And private hire, that's, again, proceed at your own risk, but it's worked out well for a lot of people. So next slide, please. With a full service agency, all the things that we do as far as providing employment to people, providing them with, because of they're employed, they pay into the Social Security system. We pay payroll taxes, things like that. So we're operating businesses. In a placement agency, again, the family is responsible. The family becomes the lawyer and all the other issues that come with it. So again, the private hires, the family's responsible for everything. Next slide, please. So obviously there's a lot of training and support that goes into onboarding caregivers. We require, the state of Illinois requires a certain number of hours for initial training and then continuing education year after year. They have to be certified. We have to be OSHA compliant. Caregivers are trained in end of life transition, especially when they're on a hospice case. And it's today with the COVID environment, infection control is very important, obviously, and then being trained in Alzheimer's. So last year, the state of Illinois put in some protocol as far as curriculum is concerned on training, that there's a certain number of hours that have to be achieved strictly in Alzheimer's and dementia care. Again, with respect to private placement and private hires, it's not available. It doesn't, they're not accountable to all those bullet points above. Next slide, please. Licensed home care agencies are bonded, insured. Again, they go through all the background checks, fingerprinting. Some of them, I can't speak for all of them, require drug testing. They have to, the healthcare worker has to be rated eligible to work in the state on the Illinois Department of Public Health registry. So if they are if they're ineligible, then they can't be placed in a home. Again, same, as before with a placement agency or a private hire, that burden falls on the family. Next slide, please. In workers' comp claims, in an agency, agencies like ours are fully insured for worker-related injuries. Placement agency, it's a crapshoot, excuse my language, and the same thing with private hire. So I guess, with respect to a full service licensed agency, you're getting, the reason it's going to cost more is because there's so much more that goes into it to keep everybody safe. Next slide, please. With I can speak to our agency. There are no hidden fees. Everything's in an agreement, really upfront. There's really, there's no, with respect to how we go about things, you're not contracting for a certain length of time. It's just, it's all very transparent. Placement agencies, there's an initial placement fee. There might be a residual fee depending on how long the caregiver is in place. And then the caregiver can always renegotiate beyond that as far as their rate. Private hire, again, that's something between the family and a private caregiver. So
thanks,
next
John.
slide. Yes.
I think I'll finish up the rest of the talking points here.
Okay. Thank you.
Regarding supervision, when you're working with a full service agency, you have an agency manager who does all the supervision. And many agencies do have a registered nurse who provides the oversight to the care plans and the caregivers. And that's a great resource because when there's a hiccup in the home, the caregiver can call the agency and talk to a clinical person and report client changes such as weight, pain, maybe there's some injury in the home, maybe the client bumped their wrist on the door jamb as they're going into the bathroom in the wheelchair, or if there's changes in ambulation or infection or cognitive changes. So it's great that they've got someone to call and have questions. COVID is a huge issue right now. People are asking a lot of questions. Do I need to get tested? Have they gotten their vaccine? And we're all challenged with the questions from the families and the caregivers and providing the support that they need. In addition to providing them with the PPE equipment for providing the care in the home, whether it's masks, gowns, gloves, face shields, your agency is going to be able to provide those kinds of supplies to their staff. With a placement or a private hire agency, most of the time the families are going to have to provide that equipment to the caregivers. In regard to experience, look at the agency's hiring practices and what their experiences are, whether they have health experience and patient care experience. Family is responsible for employment verification if you're looking through a placement agency or a private hire. And it can be a challenge when you want to verify employment. Are they credible references? There's limited screening. The family becomes the employer and they're responsible for filing taxes or workman's comp. We recently heard of a family who had a private caregiver and the client passed away and the caregiver filed for unemployment. And the family was unaware that they were the employee or the employer, and they were liable for that caregiver's workman's unemployment for 6 months. And when you're doing a private hire, are you able to really verify their employment other than maybe an aunt or an uncle or maybe a former client? You really know if they're a former client. And being able to do background checks. Like John mentioned, we have to go through the healthcare worker registry portal. We have to register for that service, and unfortunately it's not available to the general public. When we look at costs, a full service agency, the hourly rate in this area ranges between $28 to $35 an hour. Bear in mind, about 75% of that is labor. It's the cost of the caregiver, their taxes, their unemployment, their workman's comp, and the insurance. Live-in averages between $275 to as high as $400 a day for a live-in. Placement agencies, there's generally a placement fee, and generally there's a percentage of their wages. Usually it's an hourly rate that you negotiate with the caregiver, but then a percentage of their wage tends to go back to the placement agency for as long as you have that caregiver in place. The private hires, and you can find them online, Craigslist, Facebook, there's different online services that people promote themselves to find private jobs. And I've seen their hourly rates range between $20 and $30. So, and you have all the risk and liability, and that's what a full service agency offers you, is taking that risk and liability off the homeowner, and offers you more protection. Service agreements. A full service agency is mandated by the Illinois Department of Public Health. It is a license requirement that we have a service agreement. One of the things I always ask individuals, families to look at is looking for, is there a deposit required? Some agencies might require a 2-week or 1-week deposit, and they bill against the deposit, or the deposit is returned upon termination or cancellation of services. Also want to explore what your payment methods are. Can they take checks? Can they take credit cards? Is there a service fee on the credit card? Also, can they do bank transfers? And then your termination or cancellation. Is there a 7-day, 14-day, or 24-hour notice for cancellation of services? When you're working with a placement agency, I'm not sure what their termination is. I don't think there's a service agreement. You're making that arrangement privately with that caregiver. And a private hire, generally there's none required unless you hire an attorney and you draft up a caregiver agreement. Generally, we see this when a family member is hired to be the family caregiver. So we put together a list of a couple questions to help get you started. So when you need to find an agency, here's a list of some questions to get you started. You want to make sure that they're licensed by IDPH. There are agencies out there that might look like they're licensed, their website looks beautiful, they've got a Facebook page, but they're not licensed. And you can call IDPH, you can call Springfield and verify if they're licensed or not. Or you can ask the agency to provide you a copy of their license and their insurance. If they are unable or unwilling to provide that with you, I would call somebody else. Ask how many years that agency or that franchise location has been in business. Do they have a physical office? Right now, we're all working virtually, but how do you reach people when you have a question or you need some assistance? And what services do you offer? Not every agency works in dementia care. Not every agency prefers to work in end of life and hospice care. So it's important to know the services that you need, and does that agency offer them? Do you have a minimum number of hours? It could be 4 hours, it could be 6 hours. Right now, many agencies are requesting full-time, 40 hours or more because of COVID, and they're trying to eliminate the caregivers working in multiple homes. And then how do you supervise your care providers? And is your agency available 24/7? Try to call somebody on a Friday night at 5:30 and see who's available. And ask about the COVID precautions. And this is a two-way conversation. The agency is going to have that with the client as well, understanding what the risks involved, what the COVID exposure is, who is in and out of the home. Has the client been hospitalized or in a skilled nursing facility? What is their exposure and any precautions that the family has taken? This slide shows a couple resources. This is a quick link to the IDPH website of the Home Services Directory. It's generally about 4 months behind, but it still gives you good insight into if you're looking to verify licensure. You can start here. If you can't find them on the list or you don't see them on the list, you can call Springfield and inquire. The Genworth cost of care. This is a great little tool. You can use this to look in different counties for cost of care for adult day, skilled placement, memory care, home health. They publish this every year, and it's a great resource if you're interested in learning more about what the cost of care is in your area. Gina, are you next?
Hi, everybody. Thanks, Susan and John, for that great overview of the home care availability for happy aging in place. So I'm going to talk a little bit about care management, but first I'm just going to talk about this slide. How can you afford to stay at home? There are options for every budget, so that's the good news. Sometimes the options are a little bit limited if you are on a limited budget, but there are options for caregiver services through the Department on Aging if you qualify based on your income. So those are no cost to you, but again, you have to qualify for your income, and that information can be gathered through your local area agency on aging. And we'd be happy to put you in touch with that, but you can just search for local area agency on aging. Every community has one. Sometimes it might be your local senior center. It might be Catholic Charities in one community, Council for Jewish Elderly in one community. So every community has a branch. So that's an option for limited budget. Other than that, as John mentioned earlier, it is private pay for caregivers at home, or also VA benefits or long-term care insurance will also pay for that. The other thing that I think you heard a little bit more about at the last presentation was home modifications. So there are a lot of home modifications that can be done that don't cost very much. And so when you look at the cost, some things that's not that expensive might allow you to stay in your home just for a few more years, so that you can enjoy that independent living just a little bit longer. Other things that might be more expensive, you just really have to kind of look at the risk benefit ratio, or the cost of staying home versus the cost of moving to a facility. So there's lots of things that come into play. And the nice thing about being connected with a network of professionals is that we can kind of help you navigate through all of that. And I'm going to talk a little bit more about a care manager, and this person can be a great supplement to your care team, and someone who can help you really take a look at all the aspects of what it might involve to stay at home, or look at what all your options are. So what is a care manager? This is kind of a fairly new field, and a lot of people don't know that this even exists. So a care manager is an experienced professional who helps older adults and their families obtain information, access services, and offer options that help ensure the older adult can experience the highest possible quality of life. So they can help you look at all of your options. So sometimes they can help with housing options. They can help you find a home care agency. They can help you find a home health care agency. They can help you find a hospice agency. There's lots of companies out there. And so a geriatric care manager has experience. So this is someone who has done this many times, as opposed to the average person might be doing this for the first time. So there's a huge learning curve. So it really can benefit you to really access the knowledge and wisdom of a care manager. Many care managers are nurses. Some of them, like myself, are master's prepared. So there are different levels of care managers and also different areas of specialization. There's some care managers who really specialize in, for example, the insurance situation. So as you probably know, they're just choosing a Medicare plan, choosing a drug plan, that in and of itself is a whole niche area of expertise. And there's lots of training that's available for professionals who want to help seniors navigate that scenario. And there's also care managers who specialize in specific medical conditions. So there's lots of options out there. Let's see. So when would you need a care manager? as you can see from the slide, when there's been a change in healthcare, a change in a diagnosis, some kind of medical event, perhaps a hospitalization, some kind of crisis, a fall. A lot of times those types of situations can trigger the need for a care manager. Some other things that a care manager can help you with are things such as acting as a liaison between multiple family members and professionals. Some people have a trust officer involved. Some people have an attorney that's involved in the planning of the care. So a care manager can kind of act as a coordinator and communicate with everyone to make sure everyone's on the same page. Oftentimes when there's multiple family members, it's really helpful for a care manager to help coordinate those things. As I mentioned, housing options, escorting to medical appointments, arranging for care as we talked about, assistance with insurance, Alzheimer's counseling and guidance, and of course, referral to available programs and services. Next slide, please. Thank you. So who advocates for you? Who coordinates for you? This is a question that you can ask yourself. If you are doing all of your own care coordination and everything, bravo, that's great. But sometimes we have to know our own limitations. When we need to call into our reality, someone who might have done this before and offer a little bit more expertise and experience with that might be a helpful thing for you to add to your care team. So as we talked about, a care manager can help you do insurance planning, long-term care insurance, help you look at Medicaid options, home health services, and all of the things that you see on this slide. Let's see. They can help explain your choices, look at your budget and see what might be available for your specific financial situation. Next slide, please. So as I talked about a little bit, a care manager can kind of act like a conductor, a coordinator among a lot of different professionals to try to make sure that everything's well communicated and coordinated and kind of a continuity of care. So, there's lots of different types of senior living communities. So housing options, as we talked about, reverse mortgages is another way that you can look at possibly paying for some services. We didn't really talk about that, but they're going to talk a little bit more about that at the next presentation. But a reverse mortgage can be a very good option for certain people. So that's not something that you should completely rule out either. But talking to a trusted professional, someone who has integrity, and we do have some members in our group, the National Aging in Place Council, who are reverse mortgage professionals. I'm sure you'll hear more about that next week. Adult daycare is another option. Adult daycare is a program where it's kind of like a program that you go to every day or a couple of days a week. And they often provide activities, oftentimes a meal, medication, assistance with medication, and sometimes medical services. So that can be an option as well to help people stay in their homes longer. Local senior centers are a great option too, to just kind of plug into and get connected with services, and also for socialization. Next slide, please. So as we mentioned, care managers are specialists in aging and kind of act as a coordinator. I often feel like a social worker when I'm working with a client. I do a lot of social worky type of things I talk about. So and people will ask me like, what can you do? What can you not do? And I'll say to them, there's not a whole lot I won't do for people. And that's the nice thing, is that when you have a care manager, there's sometimes when I go to a client's home and the towel rack in the bathroom is loose. And I'll say, well, do you have a screwdriver? And I, do a quick little tightening of the towel. Oh, thank you so much. For them to try to call a handyman, is a lot of effort sometimes. So just the fact that I'm there, but of course, then I'm also doing other things and I'm observing their, you know, their overall well-being. I mean, I'm not just there to fix their towel rack, but just one little example of something that might come up, that it might be hard to find somebody to do something like that, but because I'm visiting on a regular basis, I can do a lot of little things that might otherwise not, you know, go unaddressed. But oftentimes I also tell people that it's kind of like having another adult professional person kind of at your beck and call. And so the other nice thing is a care manager can be involved as little or as much as you want them to be. Most care managers will respond to whatever the client's needs are. I mean, I have a client that I visit once a week for about an hour. I have other clients who I see once every 2 months. And so it just depends on what the person wants and needs. And so there's lots of flexibility there. But the other thing is that it's nice to have a relationship in place with a care manager before there's a crisis. And we at the National Aging in Place Council, we always talk about making a plan. It's always good to make a plan. We don't like to get those calls where people are in crisis, although it happens more than you probably realize. But we get calls all the time in crisis. We respond, we help, we jump in and do what we need to do. But I will tell you that it's much more preferable to already have an established relationship with a client and be able to jump right in if and when there is a crisis. So I would encourage you to consider having a care manager, a relationship with a care manager, and that way, if you ever needed something, they will be right there for you. Sometimes people ask me, how much does that cost? And so care managers generally range from around $85 to probably around $130 per hour. And there's usually a travel fee that goes along with that in addition for an in-person visit. So, you know, it is a little more on the expensive side, but like I said, some of my clients, I might only be seeing them once every 2 months. And for the occasional time that I have to do some work sort of behind the scenes, I talk about like at my desk or I'm making calls, it's also billed out at that same rate. But again, to have the expertise and someone who's kind of done that before, to me is, you know, a lot of people feel that it's worth it. Let's see, I think next slide, Susan. Okay, so I also want to mention a patient or a health advocate. This is a relatively new field as well. It's very similar to care management, but it is a little bit more focused on the medical piece. And here is where the professional has more of a certain expertise. Like you might find a patient advocate who really has specialized in cancer or stroke victims or other specific, you know, medical conditions. So I think that you will probably receive a copy of this presentation. So there's a great little YouTube video that's there. I'm not going to show it now, but it's about a 7-minute video. It's a good overview of patient advocacy. Again, very similar to care management, just a little bit more medical focused. So I think that's about it. All right, yeah. Next slide. I think that's all for me, Susan. Yeah, I'm going to turn it back over to Rick to close us out here.
I'm back. Hope everybody's enjoying themselves. I see a little bit of action in the Q&A in the chat, so we'll get to that here in a couple of minutes. I think if there's anything you can hopefully take from this, you kind of in summary is that, you know, regardless of, you know, your profession or your age or your ethnicity or religious background, you know, all of us, you know, we're kind of your community. You know, we're your support network to help you age in place. You know, the aging in place consultants have lots of professional resources right here in your community to help you with your aging in place, develop your plan, answer your questions, and really want to try to address any needs that you might have. You can rely on each of us to help connect you with the resources you may not have even thought of as we have a dialogue. Next slide, please. So as Dr. Phil would say, if you don't have a plan, days turn into weeks, weeks turn into months, months turn into years, and before you know it, you're looking back saying, gee, I should have had a plan. Next. So as Nadia, as Sadia mentioned earlier, we got legal and financial planning, the same group presenting next Tuesday evening at 6:30. The following week, we will again be back with you talking about transitioning to senior living. Links to register for these programs are available on the library website. And in terms of other resources, here's a couple, a website and an email. If you have further questions, about our conversation this evening or any other topic related to aging in place, you can go to the website to find resources, or if you have a specific question, you can email that to Chicagoland at ageinplace.org, and somebody will get back to you with a more specific referral or reference to someone that can help answer your question. So do we have any questions, I guess?
Yeah, Rick, I think we do. I'm going to stop my screen share so we can all, there is a question in the Q&A. Do care managers and or patient or health advocates have any certification or licensing to validate their positions and training? Gina, you want to answer that one?
Yeah, I can answer that. So patient advocates are, I believe, in the process of doing a certification and licensing. Is that right, Susan? Would you?
Yeah, they're in I think 2 or 3 years now of having a board certification exam.
Yep. And care managers are not required to have a certification, but I believe there is a professional certification as well that's available. And I'm guessing both of those industries will most likely move to full certification, in the coming years.
Mm-hmm. Another question is, can you use long-term care policies to pay? And our hybrid policies accepted as well, since long-term care is part of a hybrid policy. Every policy is different. You need to know what your policy covers. Does it cover hospital care? Does it cover skilled nursing? Does it cover home care? We can help you uncover what your policy covers. And then you have to submit a claim and it has to be approved. But I would generally want to say yes, but we need to understand what the benefits are. And then you have to submit a claim to see if it gets approved or not.
Yeah, another comment, Susan, is that depending on the age of that policy, if the policy is over 10, 15 years old, some of the terminology in that policy may not apply to the world today. And so you may have to get some guidance from your insurance company, to see, how the language from before probably applies today, but it might not be clear to you.
Yeah, and I just would add that some policies have limits. Some policies have like a daily limit or a weekly or monthly limit. Some don't have any limits. So really every policy is different. And, we can help, all of us who work in home care can most likely help you look at your policy and just take a look. But you can also just call the company and I'll help you navigate through that too.
Mm-hmm. No, good question. I think let's see, is there one more here? Just popped in? No, I think we got them all covered. Everything's done in the chat. Okay.
Right. Thank you so much, you guys. This is very helpful information, and I hope everyone who joined got benefit from it. And again, we recorded this session, so you will be able to see it on YouTube channel once we get that uploaded. And if there's no more questions, hope everyone has a great rest of the evening. Thank you all for joining, and thank you, panelists, for taking time out to give us all this information. All right.
Welcome.
Thank you.